October is Breast Cancer Awareness Month, and Dr. Nadia Pile, an OB/GYN provider with Women's Care Florida, joins us with everything that we need to do and need to know to help prevent breast cancer. Welcome to the show, Dr. Pile.
Thank you for having me. I'm so happy to be here to speak about breast cancer awareness during October.
I'm excited that you're here. I notice you've got your pink on, helping to spread awareness, which is always so important this month. So let's first break it down again. You hear the numbers. I feel like everybody knows somebody who has battled breast cancer in their life. What are you seeing these days? Where are our numbers?
That's so true. Almost all of us know someone who's had breast cancer, whether it be a family member, a close friend, or even a colleague. And hopefully we know that women are living very long with this disease. But the reason why we see it so frequently is because the incidence is about 1 in 8 over one's lifetime. But typically at age 40 is about 1 in 70.
Really? So the numbers are still there.
Yes.
Let's talk early diagnosis, because you always hear that that's everybody's best bet when you are given a diagnosis of cancer. What do people need to do? How can we stay on top of it?
So it differs based on what society you're referring to, but typically in our community, doctors recommend screening with mammogram at age 40 and every year thereafter.
And I know that sometimes you said like which kind of group you're listening to, because right now I think that's a little bit in the headlines, right?
Quite true. So, for example, the United States Preventative Task Force recommends screening at age 50. I don't like to delay until age 50 because our patients are at risk, and I believe that we get better baseline mammograms if we start at age 40.
And I know a lot of that deals with your genes, your makeup, your family history. How important are those aspects when deciding to get screening and, of course, informing your doctor?
Well, extremely important. Certainly there are risk factors that increase one's chances of breast cancer. So being a woman alone, if you have breast, then you're at risk for breast cancer, increasing age. And then family history is an important component of that. So know your family history. Speak to your parents and your grandparents. Try to know what cancers are in the family and related cancers such as colon or prostate cancer. Once you have your family history, then share it with your healthcare provider or your physician, and then they can direct you to genetic counseling for testing such as BRCA, which is a common cause of increased risk.
I like that you talk about like going to the counseling, kind of figuring out what the next steps are going to be. Well, let's talk about when you're at home, those self-breast examinations. You know, I feel like we heard a lot about them for a while. Is that still something that is recommended, and how often?
So self-breast exam is actually not recommended, but what I like to promote is self-breast awareness. Be aware of your body. If you feel something in the shower, say something. If you see changes to your skin or strange discharge from the nipples, say something. Bring that to your provider's attention so that you can be properly evaluated.
You know what? I'm so glad we're doing this, because again, I just learned something new there. And I feel like information is always changing. Information is always out there in the headlines, that this is why it's so good to do these segments, to get us kind of up to date where things stand. And of course, when you think about being up to date, treatments. What are some treatment options today, and how's it going?
So, you know, just a few years ago, treatments were limited. Women had removal of the breast or mastectomy, chemotherapy, and radiation. Well, now the treatments are more targeted to the particular cancer. So if a woman, for example, has an estrogen-positive cancer, then there are drugs that target the estrogen receptor. And so treatment is more individualized, it's more effective, and therefore our cure rates are far better.
Interesting. I didn't even realize, too, that you have been able to take it and figure out which cancer it is. Of course, you hear different types of cancer, but I didn't realize there were different types of breast cancer.
Yes, ma'am. So breast cancer is divided into ductal cancers or lobular cancers of the breast. And then there are further subdivided into their receptor positivity, whether it be estrogen receptor, progesterone, or the HER2 receptor. And then the treatments are targeted for those receptors.
Wow, I had no idea about that. Again, I'm so glad that we're talking about this today. And so if you do leave people with one note to keep in mind at the end of this segment, what would that be when it comes to breast cancer prevention or breast cancer awareness?
I think the most important thing is to not be afraid of screening. Women's Care Florida has an excellent screening center both in St. Pete and Tampa. Screening is easier than you think. Go and get your mammograms.
I'm glad to hear that. So glad to meet you today. And again, just to stay up to date, I definitely learned things new in that segment. We really appreciate your time and you joining us. As always, if you want more information, if you want to see Dr. Pile, of course, contact Women's Care Florida. There's the website you see on your screen.